And what causes a tooth to become sensitive? You know, there are some people that, you know, they have some ice or something cold and it just gets like, ooh, and they're going, ouch.
When the dentin is exposed is when you get sensitivity. Remember that the enamel covers the crown, but not the root. So let's say you get gingival recession, the gum travels south, and some of the dentin tubes get exposed, then you get sensitivity to cold. And also as a tooth decay progresses, once it reaches the dentin, that can cause sensitivity at this area.
And in that area that we see, obviously, the vessels, does that cause that area to then, I guess, die down and then your tooth falls out?
Correct. Well, it doesn't fall out, but it gets a lot of pain because remember, this is like an enclosed chamber, and then the pulp inflames and it has nowhere to expand to, so you get a terrible tooth pain. If you don't floss and have a lot of gum disease, the bone around starts migrating down, and then the tooth may become loose, and that's when it falls out.
And doctor, what's the connection between oral health and overall health?
Oh, there's a big connection, actually. Recently, there's been links to cardiovascular disease and chronic inflammation in the gums, endocarditis, which is the infection of the inner layers of the heart, and so forth. Diabetes and HIV patients are more prone to getting infections, so oral health is very important to maintain. Osteoporosis may cause loss of bone around the teeth, and some of the early indications of osteoporosis can be picked up in dental x-rays. Also, Alzheimer's disease, in some of the brain tissue of Alzheimer's disease patients that have passed, there's been some indication that there's some bacteria that may come from the gum infection of and chronic inflammation in the mouth.